Hello everyone, welcome to the first video of the shoulder anatomy. So in this video series we're going to go from talking about the shoulder anatomy to plain films to MRIs and kind of cover all the basics of shoulder orientation and then eventually get into the pathology.
This is just a quick glance at the anatomy of the shoulder, and for the plain films we're mainly going to be focused on this area over here. So the important landmarks to know are the acromion, the clavicle, they kind of form the AC joint, and the coracoid process, which is more anterior, and then the head of the humerus right over here, and the anatomical neck, and then the surgical neck, and then we have the scapula over here. So this is the key area of focus, and kind of knowing what's anterior and what's posterior can be helpful in identifying what we're looking at on the shoulder plain films.
There are several different projections that are utilized in plain films when taking x-rays of the shoulders, and the reason for that is because these different orientations help us understand certain pathology better. For example, a posterior and anterior dislocation is viewed better in one orientation versus the other, or certain kind of fractures are viewed better in one orientation compared to the other. So there's the five main orientations. There's the external rotation, the internal rotation, the Y view, the axillary view, and the gray sheet view. This view is the shoulder in external rotation. It's anterior to posterior, and the best way to identify this as an external rotation is by identifying the greater tuberosity. It's usually really prominent. So here I have all the structures labeled for the first one. Here we have the clavicle, the acromion, this is where the AC joint is, the coracoid process. Right over here, this is the anatomical neck, and this would be the surgical neck going from here to here. And the best way again to identify an external rotation is by identifying the greater tuberosity, which should be really prominent, as we can see in this view. And this is the lesser tuberosity. This view is in the internal rotation, and the best way to identify the internal rotation is by looking at the head of the humerus. Notice how it's very symmetrical and has a light bulb-like appearance, as opposed to what we saw in the external rotation where the greater tuberosity was really prominently visible. So by identifying this symmetrical appearance, we can kind of cue in that this is a view in the internal rotation. And these specific views are used to identify specific things. So this view is really good for identifying Hill-Sachs fractures, which we'll get more into later on. This is the axillary view, and it can be a little hard to kind of orient yourself in this view. So I like to imagine the patient having their arms out, and then the x-ray is hitting this way and capturing these structures, which are then projected on this plain film. So this is the head of the humerus, and this is the clavicle coming in from the back. This is the glenoid over here, and this is the coracoid process, and then the acromion is kind of posterior in this area. And this view is really helpful for identifications of anterior, posterior dislocations, which we'll get into eventually.
Again, this is the axillary view, and these are just the labels to kind of make it more clear. So we notice the head of the humerus right over here by the red outline, and then the clavicle coming in here, kind of this line right here, and the coracoid is kind of posterior to the clavicle in the view, and right here is the glenoid, and then the acromion is kind of posterior to the head of the humerus. So again, this is the axillary view.
This is known as the Y view because of the orientation that we see on the plain film. So we notice how it makes a Y right over here, and this can be a bit confusing to kind of orient with initially. So the way I think of it is it's posterior to anterior, and the beam is kind of going this way from the back and capturing these structures, so kind of going at an angle. So over here, this is the acromion, this is the coracoid, and this is kind of the body of the scapula. So the beam is kind of centered at the body of the scapula, and these are the structures that we capture. And in the anterior side, we notice the head of the humerus, which should be centered in the Y. If it's located this way, then that's an anterior dislocation, or if it's more this way, it's a posterior dislocation. And we can kind of imagine that this, you can see over here, this is the acromion, this is the coracoid, this is the clavicle coming in, similar to what we see over here, and the beam is going this way. So that's how this image is captured, and again, it can be used to identify anterior, posterior dislocation.
So this is just all the structures that we talked about labeled, so we can kind of see them here. So the head of the humerus is in the center, and then the Y that's formed from the coracoid, the acromion in the body of the scapula, and the clavicle at the top. This is an example of the Gracie view. It's usually used to identify the joint space between the glenoid and the humeral head. So we can notice how the joint space is well maintained, and this is a normal scan. This is the head of the humerus, and right here is the glenoid. Over here is the clavicle, the acromion, and the coracoid. Before we move on to the next video and discuss specific shoulder pathologies, I just want to go over a case really quick, which highlights how different views can be helpful in identifying certain pathologies. So in some views, it's easier to identify a certain pathology versus the other views. So this is the Y view, and this is an AP view. And at first, it might be hard to notice anything wrong in the AP view, although in the Y view, we clearly notice how the head of the humerus is not correctly aligned as it should be. So as we talked about earlier, the head of the humerus should be centered within the Y, and it's clearly not centered. So this is an example of posterior dislocation because the head of the humerus is going this way. If it was going this way towards the ribs, it would be an anterior dislocation. And as we talked about, the Y consists of the body of the scapula, the acromion, and the coracoid. And the head of the humerus should be nicely centered in the middle. And in this case, it's going more this way, which is a posterior dislocation. And so this is really easy to tell from a Y view, although it might be a little tricky to tell from an AP view. Although we can notice how there's a nice kind of a light bulb sign that we notice with the head of the humerus, which is classically noted in posterior dislocations. So it's almost as if the shoulder is in an internally fixated position. There should be an overlap between the glenoid and the head of the humerus, which we don't notice in this case. So it's a positive for a light bulb sign and classically consistent with posterior dislocations. And posterior dislocations are hard to identify in an AP view, so a Y view is really crucial in many cases. And I thank you guys for watching this video, and in the next one we'll go more into specific nuances and pathologies of the shoulders.